The impact of Hcahps. What are Hcahps? Hcahps stands for Hospital Consumer Assessment of Healthcare Providers and Systems. It is a method of collecting and reporting the perception of healthcare by patients to help enable valid comparisons for all hospitals. It is mandatory for hospitals that receive Medicare reimbursement. An Hcahps survey is a series of questions asked to patients following their discharge to learn more about their stay at a certain hospital or facility. The hospitals chosen include Stillwater Medical Center compared to Mercy Hospital of Oklahoma City and Integris Baptist Medical Center of Oklahoma City. National average ratings include an overall rating and a patient survey rating. An overall rating shows how well each hospital performed on a set of quality measures compared to other hospitals in the United States. The patient survey rating summarizes patient experience of care based upon a series of questions regarding hospital quality. Stillwater Medical Center had an overall 4 out of 5 rating, a patient survey rating of 4 out of 5. Mercy Hospital had an overall rating of 3 out of 5 and a patient survey rating of 3 out of 5. And Integris Baptist Medical Center had an overall rating of 2 out of 5 and a patient survey rating of 3 out of 5. The hospitals chosen are Integris Health, Mercy Hospital, and Stillwater Medical Center. These are acute care hospitals. They provide emergency services, and they promote interoperability of the certified EHRs, which allows patients the ability to view their test results and labs via a patient access portal. On the Hcahps survey, there are questions in regard to patient experience. Patients that reported their nurses always communicated well. Stillwater Medical Center received an 83% rating. Mercy Hospital received a 75% rating, and Integris Baptist Medical Center received a 76% rating. The national average is 79%, and the Oklahoma average is 80%. The survey of patient experiences includes a question stating, patients that reported their nurse always communicated well. Stillwater Medical Center received an 83% rating, Mercy received a 75% rating, and Integris Baptist received a 76% rating. The national average is 79%, and the state average in Oklahoma is 80%. One question asked in the survey of patient experiences includes a question stating, patients who reported that the staff always explained about medicines before giving it to them. Stillwater was at 61%. Mercy was at 53%, Integris Baptist was at 53%, the national average is 61%, and the state average in Oklahoma is 64%. Another question on the survey of patient experiences states, patients who reported yes, they would definitely recommend the hospital. Stillwater Medical Center received an 83%. Mercy Hospital received a 73%, and Integris Baptist Medical Center received a 73%. The national average is 69%, and the state average in Oklahoma is 71%. Timely and effective care in regards to sepsis. Sepsis is caused by an extreme response to an infection. It causes damage to the organs in the body and can be deadly if it turns into septic shock. Early identification leads to more prompt care, increasing the chance of survival. The percentage of patients who received appropriate care for severe sepsis and/or shock is listed below. Stillwater Medical Center received a 67% rating, Mercy Hospital received a 61%, and Integris Baptist received a 64%. The national average is 58%, with the Oklahoma state average being 51%. Complications and death. The death rate for pneumonia patients are as follows. Stillwater Medical Center, 17.7%. Mercy Hospital, 18.8%. Integris Baptist Medical Center, 21.8%. The national average is 18.2%, and the Oklahoma average is unavailable as per the CMS website. Unplanned hospital visits. The rate of readmission for COPD or chronic obstructive pulmonary disease patients. Stillwater Medical Center had a 20.4% readmission rate. Mercy Hospital had a 20.2% readmission rate. Integris Baptist Medical Center had an 18.9% readmission rate. The national average is 19.3%, and the Oklahoma State average information is unavailable per the CMS website. The use of medical imaging. The percentage of outpatient CT scans of the abdomen that were combination or double scans. Stillwater Medical Center is at 13.3%. Mercy Hospital is at 10.7%. Integris Baptist Medical Center is at 6%. The national average is 6%, and the Oklahoma State average is 8.2%. Payment and value of care. Value of care ensures hospitals are providing patients with quality care and treating their condition adequately. Value in healthcare encourages hospitals to reduce unnecessary care and maintain a high-quality care standard. In regards to heart failure, the death rate for heart failure patients is listed below. Stillwater Medical Center is at 12.8%. Mercy Hospital is at 14.7%. Integris Baptist Medical Center is at 12.3%, with the national average being 11.8%. Influencing factors in regards to doctors' communication. Good patient-physician communication affects a patient's perception of care. The ADET, or acknowledge, introduce, duration, explain, and thank you approach helped with communication issues between providers and patients. When patients feel heard and understood by their provider, they feel as if they are receiving quality care. Communication about medication. Proper medication education ensures patients understand the medications they are taking and the reasoning they need the medications. Without proper communication, patients can often feel they are not properly medicated or are being over-medicated. Medication communication from the physician to the patient ensures that the patient is being treated properly for their medical conditions. Discharge information. Some issues that arise with discharges include difficulty with comprehension leading to frustration from patients and the inability to understand information about their medical conditions. One-page intervention discharge instructions resulted in positive outcomes and feedback from patients. Patients were more compliant with their discharge information. The teach-back method is also very effective to ensure that patients went home with the proper information, medication, and/or resources that are needed. Quality. Low quality of care equals low Hcahps scores, which in turn equals low reimbursement. High quality of care equals higher Hcahps scores, which in turn creates a higher reimbursement for the facility. The goal of Hcahps is to improve the quality of care. Quality. Low quality of care equals low Hcahps scores, which in turn equals low reimbursement. High quality of care equals higher Hcahps scores, which in turn creates higher reimbursement for the facility. The goal of Hcahps is to improve the quality of care. The references for this PowerPoint presentation are listed below.